is up, everybody? Welcome back to Clinical Sprinkles. My name's Pauline and I'm a physical therapist. If you learned something, please give thumbs up, and if you have questions or comments, please leave them below, and then subscribe to my page so you don't miss out on future episodes. So today we're going to be talking about what type of questions you want to ask during an interview to your potential employer. This was a question brought up by one of my followers on Instagram. Thank you again for the idea. So I came up with a list of things that I had asked my future employers, and I just went through an application process just recently, and so these are kind of the key things that I asked about. So first off, what are the continuing education benefits? Sometimes they'll tell you up front when they're going over the job description of what that company is going to provide for you. But for me, that was a big aspect, and because when I first got out of school, I was interviewing for a few places. I could kind of compare and contrast, like, oh, well, this company was going to give me this much, this one this much. I think with the circumstances that we're in now, I think the opportunities for interviews will be tough. But if you do get in the situation where you have the opportunity to kind of weigh out different options, continuing education benefits is definitely one of the factors that influenced my decision. So most companies kind of give like a number value, but I think some other factors to consider are how many new PTs are there, how many people are expecting the same amount of benefits as you, and how much do you want to spend. So these are kind of questions that you want to ask yourself. Generally, you just ask the employer, what are your continuing education benefits like, and then they'll give you, kind of what they have. But in your head, you have to be thinking, well, what kind of classes do you want to be taking? How much are those classes going to cost you? And over what time period do you want to complete those courses by? All of that kind of factors into your decision, and so that's stuff you do on the back end. I think another good point to bring up in regards to continuing education is if they have a track laid out for new grads. So if you are a new grad, or you're transitioning into a new company, you want to see if they want you to be taking certain classes that the rest of their clinicians are taking, because they want the treatments to somewhat be uniform, so they want you to have somewhat of the same framework as the other clinicians. So that's kind of what happened at my company, was that I got there, I knew I wanted to do continuing education with manual therapy. They said, hey, why don't you do this one? In addition to that, there was a ASTEM certification, which is a type of instrument-assisted soft tissue mobilization to treat tendinopathies. That was a tool system that specifically said you had to be certified to even use those instruments. So my first year out of school, the continuing education was kind of dictated for me in a good way. For me, it worked out perfectly, because then I took classes and I wanted to continue learning that. But you want to make sure that if you have specific classes you want, that it aligns with what that company values as well. And if you have enough money for it, and if you want, if you plan to stay there for a long time, things like that. Another question you might ask is, what are PTs expected to do during the downtime between patients? So I'm not talking about your lunch break or your whatever break. This is like, if you have an hour break, is your boss going to care if you leave? Or are they going to have projects for you to work on? When I had time off, I would document, I would, maybe do some social media stuff, plan in-services. I had a lot of tasks at my former job, so I had plenty of things to work on. But right from the get-go, you want to make sure that, you're not micromanaged. At least for me, that was a big deal. So knowing what the expectation is during your downtime is another factor that you may consider. Or just kind of ask in a way where it's not like, you're going to be like relaxing or like checking your phone or something. It's more like, do you have things that, like, what are your expectations of me outside of like normal PT stuff? Big one for me, especially as a new grad, was mentoring. I talk about mentoring all the time, and I think that's because that's what I feel makes me the clinician that I am today, is kind of feedback from other people. So mentoring was a big part of it, and that includes direct mentoring. So I wanted to know how much my clinic director or a senior PT was going to be shadowing me, treating patients, and even in between patients, this would be a good time for you to be, maybe you can shadow the senior PTs too, and if they'd be willing for you to do that, just kind of shadow and observe what kind of things they're doing so that you can pick up on their clinical style as well. Another part of mentoring is clinical in-services. So I think a good amount of in-services is at least once a month. Once a quarter is sufficient, especially if the person leading the in-services is maybe not always in that clinic but traveling between places. Once a quarter is fine, once a month even better. So you want to see that that clinic is really promoting education and opportunities to learn. And so I think that asking mentoring wise is if you can get direct. How open are the senior PTs able to, are willing to let you shadow them? And then what kind of in-services scheduling do they usually have? And then of course, just kind of keeping in mind if you get a good vibe from the person you're interviewing with or the clinic director, because you want to make sure that they have an open door policy where if you get stuck on a case, they're willing to step in or do like a code treat or a consult, like, hey, they'll be on my schedule after they see you one time, so that you can kind of give me feedback on what kind of steps I want to do next. That kind of environment is perfect for a new grad, because then it's, you can continue treating that patient, but you also get direct feedback and kind of maybe a direction to go off of. The last question is, would you be able to do a job shadow after the interview? It doesn't have to necessarily be that particular day. If it works better or more convenient for you to come at a different date, you can offer that. Just kind of say, hey, would it be possible to do like a job shadow to kind of get a feel what it's like here at the clinic? And then, it's yes or no. Yes would be awesome, because then you kind of get the flow, kind of get the interaction between the staff as well to see what the workplace feels like, what the camaraderie is like. Do people get along? Are they friends? Or they kind of stick to themselves? That was a big part for me, because I want to, because you spend so much time at work, and I want to be friends with my coworkers, and so I wanted to make sure that, things like, hey, do you guys eat lunch together? You can get a feel for the place, or even stay for even the last job that I just did my interview with, they did let me do a shadow for like 3 patients, and I could kind of get the flow, and I even asked them questions like, and so I was able to ask them questions like, hey, how do you like working here? What's the documentation system like? Is it pretty easy to learn? What kind of patient populations do you guys see here? And this is more casual because you're interacting with the staff versus like talking to the clinic director, where there might be a little bit more pressure. So kind of getting a gauge of like, oh, what type of insurances do you guys see? Or, what's your primary referral source? Things like that. Do you guys see a lot of post-ops? I had so many questions, and a lot of them went to the staff in terms of like the day-to-day stuff. But for the bigger stuff like money, finances, things like that, I had the discussion with the clinic director. Overall, I would say that making sure that you have a list of your values, make sure you know what's important to you, know what kind of things you're looking for in a job. Again, with the current situation that we're in, job opportunities might be slim because the people who got furloughed or laid off may be waiting to get their jobs back. So for new grads, it might be hard to, even initiate the interview process. But once you do, have some questions. Don't settle for anything less. I mean, the intimidation of school loans is of course a factor, and it's case by case. So if you need to find work and you need to, just get started somewhere, that's totally fine. Everything is going to be a learning experience being a new grad anyway. What were the things you loved about a job, and what kind of things that you wish you would have had. Well, I hope that has been helpful. If you guys have any questions, you can always find me on Instagram. I'm going to leave my name below, or you can always leave a comment on here. Thank you all for tuning in for another episode of Clinical Sprinkles. I greatly appreciate your support, and I'm launching a new website this week, so if you have a chance to check it out, I will also link that in the show notes below.